Hi there, my name is Bao. I'm a graduate from Huế University of Medicine and Pharmacy in Vietnam. In this video, I'm going to summarize my case report with Dr. Alaimo published on Cureus last month. So this is how my case report appeared on the website. Let's jump right in. We report a 54-year-old Caucasian male presented to our clinic with the classic symptoms of Glossopharyngeal Neuralgia, or GBN. His symptoms started at the same time he had COVID-19. So after ruling out all the possible structural lesions on the MRI, we thought that he might have GBN secondary to COVID-19. We recommend him the first line medications, and at the 3-month follow-up, surprisingly, he reported that he didn't take any medication at all, but his pain was entirely resolved. So, two things we want to discuss. First is the possible associations between COVID-19 and GBN. The extent of a cranial nerve innervating the respiratory tree may correlate with that nerve's vulnerability to COVID-19. So that may explain why we see a lot of patients with the first cranial dysfunctions or loss of smell compared to other cranial nerve, or in our case, the ninth cranial nerve. Second, if GPN is truly secondary to COVID-19, it might be temporary. We found 3 other patients with trigeminal neuralgias secondary to COVID-19 who were also similar to our case, entirely resolved with or without medications within only several weeks or months. So if seeing patients with similar conditions, healthcare providers can inform their patients this potentially good prognosis to calm the anxiety. And I think that wraps up my recap. We would like to thank to our patients and Curious Journal for helping us to share our finding. Thanks for your attention and see you in the next video.